You know, the Centers for Disease Control says half of all Americans have periodontal disease. It's nothing to laugh at, I'm sure. If you have that, show your teeth when you're laughing, you're going to know whether or not that's something that you want to have a little attention paid to. And Dr. Tom Miller is here to tell us about new treatments for people who have that. So what is the actual affliction called?
Periodontitis.
Periodontitis. May I say you have a wonderful beard and mustache, by the way? Very well coiffed. So periodontitis, and what would you say, what's a percentage? How many patients don't even know they have something like that?
Most of them don't.
Okay.
Periodontitis is a quiet type of disease like high blood pressure and diabetes.
Oh.
Most of the time you don't know you have it unless you've been told by your general dentist. Or when it's getting severe, you might notice some of the symptoms like teeth shifting, drifting, maybe have an abscess. Not necessarily.
Really?
Yeah.
Huh. And it's caused by what?
It's caused by bacteria,
okay.
which if you heard the term plaque,
yeah.
Plaque is, 90% of plaque is bacteria.
I would think there'd be bad breath associated with that.
There can be, yes.
There can be.
Yes.
Huh. So now that we've all explored the goodness of periodontitis, what happens if you do have it and how do you treat it? I know you have some new techniques.
Yes, we talked a little bit about last time the introductory phase, which is getting things cleaned up, where we clean down below the gum line, get people numb, and we work with their bite sometimes. But then sometimes in this first phase, if it's, depending if the patient's a good candidate for it, we can use lasers. And we have two different types of lasers.
Wow.
So depending on the type of...
Walk us through. Okay, so you have LANAP?
LANAP is a protocol. It's
okay.
a treatment protocol and a particular laser that's approved for that by the FDA. And it's the Periolase, which is it's a fancy name, ND-YAG laser. And that's it. And this is cleaning down below the gum line, the first step of this, where we're removing the interior, the inside tissue that's inflamed adjacent to the tooth. The patient's numb during this.
Okay.
So we are cleaning and removing tissue that's diseased on the inside of the pocket. That's the bacteria. And this particular laser has an affinity for dark pigmented tissue, and some of the bacteria that cause this problem have a dark pigment as well.
And then that tissue regenerates fairly quickly?
It'll regenerate, yes.
Oh, interesting. Okay, tell us about the other procedure. That's the...
Well, the waterlase.
The waterlase.
And actually, they're two different. The Periolase is soft tissue. It can only be used soft tissue. The waterlase is used for both hard and soft tissue and has certain things that we use it for, like we're doing traditional more surgery where we're exposing bone or going to be near the bone, we'll use the waterlase.
Now, what's the recovery time on these kinds of procedures?
Actually,
usually with laser, it's quick, right?
Yeah, we've had very good responses with patients. They've been much more comfortable typically, but we can also do a few other things with it that kind of reduce that discomfort. It seems to seal some of the nerve endings, which tend to create more of the discomfort afterwards.
Well, it's good to know there is at least some kind of solution to a problem that many people might not even know they have.
Right.
All right. Thank you so much for coming in. Stick around for the shave or not shave results.
I'll do that.
I know. Thank you so much. Always good to see you. And you can check out Dr. Tom Miller. He is with Worthington Periodontal Specialists.